I have a mental health diagnosis.
Personally, I've struggled with depression.
2004, I was diagnosed with depressive anxiety and PTSD.
Personally, I have mental health conditions. I have a diagnosis of major depressive disorder and generalized anxiety.
It affects all people from all walks of life, and I happen to be one of those people that it had affected.
I have been dealing with this probably for most of my life.
There are a lot of signs that I can point to when someone needs to reach out. And when I talk about these signs, we want to think about these signs happening consistently. So if there's 7 days in a week and these signs are happening 5 or 6 days a week consistently over a couple months, you may want to reach out for help. And this is a loss of interest in things that you used to enjoy. So if you're someone who used to enjoy dancing and all of a sudden you just don't want to dance anymore, if you are having difficulty concentrating and being in the moment, increased irritation, agitation, low sex drive, loss of appetite, suicidal thoughts. Those are just some of the signs, some of the main signs that I think of when thinking about mental illness.
The other big issue that we see is anxiety disorders and panic attacks. And one of the things about panic attacks is a lot of times it's very stress related, and the first one that somebody has, it's not unusual for them to go to the emergency room thinking they're having a heart attack. It's known that those panic attacks, if you're not learning to deal and cope with them, perhaps take prescribed medication for them, it can actually lead you into a heart condition and a possible heart attack.
My mom is an example of that. She's super resilient. Maybe about 7 or 8 years ago, she had a heart attack, and she is pretty healthy, and it was connected to stress.
One of the things that I wish we did in our society was help people understand that your mental health is just as important as your physical health. It's just as important as your emotional health.
And there's still this big stigma around mental health, specifically in the African American community. You don't talk about it, you don't air your dirty laundry, we'll figure it out, we'll pray about it, but we don't go to therapy.
It's an issue that is still not dealt with. A lot of men suffer in silence, a lot of men self-medicate, and a lot of men are in denial.
I, like a lot of other people, I wasn't entirely convinced because I had sought help when I was in the Army, and my therapist and I were just not a good fit. And that happens, but don't give up. You got to keep going. Keeping going is the best thing that I ever could have done for my mental health.
Self-care should be the number one thing for you. You need to take care of yourself. If you don't, then you can't help anyone else. You can't help your family member. You can't help your children. You can't do a good job at work. You have to put an emphasis on self-care.
If you don't take care of yourself, you can't take care of anybody else. You have to start with you. And so it really should just be a part of your regular routine.
Life is good. It really is. In spite of everything that goes on, when I wake up each and every morning, I'm grateful.